Hey guys, Dr. Joe here once again. Today we're going to talk a little bit about fawning, mainly on dystocia or difficulty fawning. If you've experienced a doe that's had a few issues that she may have had a fawn, she's kind of restless, walking around like she's trying to have another one, but it's been about 2 or 3 hours and you're trying to figure out what we should do. If you know for sure that her cervix is open and she's already had a fawn, or she has a placenta hanging out like a water bag or something like that, and she hasn't had any success, one thing I like to use right away, knowing that that cervix is open, is oxytocin, 1 cc per doe. What this product will do is help make the uterus contract. This is only good for about 24 hours after fawning begins. The receptors go away, and then after you give the injections, it doesn't do anything. Also, if you have does that aren't producing any milk, this will help with milk letdown. So remember, oxytocin 1 cc per about 100 pounds works real good. Also, with those does that seem to be in or had been in labor a long time afterwards, they seem to exhausted, not feeling real good. One of the most important things we can do is try to get them rehydrated, try to get their electrolytes back in balance. One of the biggest things y'all are familiar with is, of course, lactated ringers, and I typically like to give about 30 cc's per 100 pounds under the skin. I believe when you give fluids under the skin, it's a lot safer than giving it IV. We'll go over many reasons on that, but if you're ever contemplate should I go IV or sub-Q, sub-Q is probably the most important and the safest thing to use. On those does that are exhausted and they're having some issues with the uterus, it's not contracting anymore because they've exhausted the calcium. Another thing I like to mix in, this is the calcium supplement here. You can use Norcalciphos, Calcicure, anything that's got a calcium and a dextrose supplement in it's real good for these does that are having difficulty. Typically I like to use about 30 cc's, put that in a bag of lactated ringers, 1 liter, and then you can add your favorite and my favorite vitamin B12, about 5 cc's in that liter bag. So once again, in that bag of a liter of lactated ringers, 5 cc's of B12, 30 cc's of their Norcalciphos or the Calcicure supplement. What that'll do is when calcium is exhausted, muscle cannot fire. The muscle needs calcium in order to fire and continue to contract. In long fawning episodes, that calcium can actually be burned up. So muscles can be locked up or the uterus can become flaccid. So in cases of a chance that you have another fawn in there and she is not pushing anymore, it's probably because she's just worn out and burned out of dextrose as well as calcium. So 1 liter sub-Q of lactated ringers, include in with that 5 cc's of B12, and go ahead and do 30 cc's of the Norcalciphos. Always remember too is if you're having difficulty after a doe has fawned out and she still has tissue hanging out, one of the biggest concerns I have is retained placentas. I've seen a few of those, and if they don't get all the tissue out or they don't clean out all the way, you can start getting prolapses. Those does start to push so hard, next thing you know, the vagina everts and then they start having prolapses. I've noticed that once does begin to prolapse, that's pretty much the end of it. That's pretty much bad news for a doe when she prolapses. So once again, if you're concerned about tissues not being pushed out completely after fawning, you can dart them with 1 cc of oxytocin. The cool thing about this too is also remember you have milk letdown, so if they're not bagging up, producing a lot of milk, 1 cc of this about every 3 to 4 hours for about 4 times after fawning is real good for a milk letdown. So hopefully that helps out. Please fire away with questions if you have questions. There's a few things I didn't quite go over, but I'm trying to just get it to you quick. Feel free, fire questions away and we'll answer them. Just comment on this video. I hope y'all have a good time. Good luck and God bless. We'll talk to you soon.